Thank you, everyone, for joining us today for this very important Q&A town hall on COVID-19 vaccinations for children. The District of Columbia Hospital Association, along with our member hospitals, are committed to provide accurate and timely information about the COVID-19 vaccine. We're certainly aware and understand the multitude of questions that parents have about the safety and efficacy of the vaccine. And our goal this evening is to answer your questions so that you can make the most informed decisions about the vaccine. This town hall will be recorded so we can share with a broader audience. Today, we have a panel of experts from Children's National Hospital, MedStar Georgetown University Hospital, Howard University Hospital, and Mary Center. I am Jackie Bowens, the President and CEO of the DC Hospital Association, and it's my honor to introduce our panelists and include Dr. Claire Bogard, Pediatric and Medical Director of the COVID-19 program at Children's National Hospital, Dr. India Medley, Vice President and Chief Nursing Officer at Howard University Hospital, Dr. Janine Recchi, Division Chief of Community Pediatrics at MedStar Georgetown University Hospital, and Dr. Maria Marquez, Administrative Medical Director and Mary Center and Professor at Georgetown University School of Medicine. And we're honored and privileged to have, serving with us this afternoon, joining us, Ms. Doreen Gentzler from NBC4, who will serve as our moderator. Thank you, Doreen.
All right. Thank you, Jackie. And I just want to start off by saying how much I appreciate the work that the DC Hospital Association is doing to try to raise awareness and give people the most accurate information possible about vaccinations, particularly for children. And I also want to say welcome to our friends on our NBC Washington Facebook page. I know that the folks on our panel are all DC folks. We hope we can reach a larger audience with the message about childhood vaccines on our NBC Washington Facebook page that reaches the whole region. So let's get started. We all everyone here is interested in what the science tells us and what is important for safety for our children and for our population. We know that scientists have conducted clinical trials with about 3,000 children, and the FDA has determined that the Pfizer vaccine meets the safety and efficacy standards for children ages 5 to 11. But with the new variants and mandates, there are still questions. Understandably, there are still questions and concerns on the part of parents about the safety for their children. And with only 10% of children in the ages of 5 to 11 years old fully or partially vaccinated in the district, there is clearly some hesitancy among parents. We want to help lessen that hesitancy by fielding questions here from the DC community. And I want to start out by going straight to the top. I was able to interview Dr. Anthony Fauci this morning. And one of the questions I asked him, I told him that I would be taking part in this panel discussion tonight, and I asked him what he would say to parents who have questions about whether it's safe to get their 5 to 11-year-old children vaccinated. Let's hear what his answer was. There was a lot of excitement about the 5 to 11-year-olds being eligible for the vaccine. And yet there's only about 20% of them have been vaccinated. In DC, it's only 10%. I'm hosting a panel discussion tonight with the DC Hospital Association to answer people's questions about getting your child vaccinated. What would you say to people who are reluctant to have their children vaccinated?
Well, just explain the facts to them, Doreen. First of all, children 5 to 11, there are 28 million children in this country in that age cohort. So far, over 2 million of them have been infected. There have been about 8 to 10,000 hospitalizations. Over 100 of them have died. So most people say, well, children don't get a severe disease as adults. That's true. That's a fact. They don't. But that doesn't mean they're exempt from getting seriously ill. As we know, you just need to go to the pediatric hospitals anywhere in the country, and you'll see children that are being hospitalized. That's point number one. Point number two, they're part of the community, and you want to keep the community safe. And that's not only getting adults vaccinated, but that's getting the children vaccinated. And then there's also the issue of long COVID, where kids can get infected, recover from the acute infection. And then wind up having a persistence of symptomatology that can interfere with their normal function. So there's so many, many reasons to get children vaccinated. It's a highly effective vaccine, and it has been shown to be quite safe. There really is no reason not to vaccinate the children.
All right, there you go. So that's our starting point, and we're here to answer the questions that you all have. So let's get started there. Julie asks, should elementary school age children get vaccinated? I think Dr. Claire Bogard is the person I'd like to start with here. She's the pediatric and medical director of the COVID-19 program at Children's National Hospital. Dr. Bogard, we have interviewed you for Channel 4 many times, and I know that you all have devoted a lot of resources to this COVID issue, and also to the long haul issue that Dr. Fauci was just speaking about. What do you say to that question?
Well, I would agree with Dr. Fauci, which is just, yes, you should. And I think I should put the disclaimer out that I'm a parent myself to a 6-year-old, so I have vaccinated my own child as well. Like everyone else on this call, we don't get paid extra from our hospitals or from Pfizer if you get vaccinated. Our goal is just to give you the information so you feel more comfortable with it. And so, like Dr. Fauci said, it's right to say that children do not have a severe illness to acute COVID as the older cohort of people. So older people tend to do worse, and that's true. But I think as parents, our goal, right, is to keep everyone safe, healthy in school. We want our kids to thrive socially and emotionally. And when I think about COVID for my own daughter, I not only worried about the acute infection, because being a part of a hospital system that is crowded and full with very sick children, keep in mind 1% to 2% of kids that get COVID are admitted to the hospital, and a third of them have never been sick before. They were healthy kids. And when you look at the kids that are admitted, a third of them need critical care or life-saving treatment. So even though it is a lower risk, getting admitted to the hospital can be traumatic emotionally. It can be medically devastating. And honestly, we live in America. It's financially stressful for most families. So if you think about all of that and the acute infection, it still worries me. And then you have children who can get like the long COVID, like Dr. Fauci said, but you can also develop something called multisystem inflammatory syndrome in children, which is a life-threatening immune system response to the COVID infection. Usually happens like 1 to 2 months afterwards. And that is more severe than the infection itself in kids. Like 2/3 of those people need life-saving treatment and can be very devastating. And then, as many of the people here on this call can attest to in clinic, we have seen the pandemic medically affect our kids in different ways, even if they don't get infected with COVID. So type 2 diabetes has tripled over the last year. Obesity is skyrocketing. Mental health concerns that were rising before the pandemic are now even worse than before. And the isolation of the pandemic is making it really hard to get to these kids and give them the resources they need. And then, of course, socially and academically, right? They were doing virtual school. A lot of teachers can attest, and there's now science to prove that people are entering the school system at an academic level below what they should be. And so our goal is to get kids back on track, to get them back to engaging in their community the way they can. So if you're not scared of the infection itself, just think about all the other consequences and all the other accommodations you've made to keep your kids safe. The vaccine is safe. There are no long-term side effects. There are no acute serious side effects. There have not been any cases of myocarditis reported or severe allergic reactions. So when you weigh risks and benefits, getting sick or being unvaccinated in a sick environment, so in the current environment in the United States, is far riskier than getting this vaccine. So sorry, it's a long-winded answer, but yes, please consider this vaccine. That's why we're here today. It's
a great answer. And we don't want to scare people, but we do want to share what the potential issues are if you don't get your child vaccinated. Let's see. Are children younger than age 12 at increased risk of infection? That's an interesting question. Dr. India Medley, let me turn to you. You are with Howard University Hospital. Is that accurate or not?
Yes, it is something that we have to take very seriously to consider, because with schools already open and they're back to school, the children in classes, in extracurricular activities during the weeks and weekends, holidays are coming up. There's programs, special events. Yes, they are at risk of getting sick from COVID-19. And when we also, because of this pediatric population, we also have to be concerned with, are they up to date or current with their regular immunization schedules? Because since the pandemic began, there's not been office visits as they were traditionally. There's been some telehealth outreach from physicians to parents and children. However, not everyone has that access. So we're concerned about their regularly scheduled immunizations, and we're very concerned as well about their getting the COVID vaccine. Because as was already mentioned, there are other complications that can come along with that. And we just don't want the children so far behind in well-child visits and well-child preventive therapies for them, so they can have a healthy childhood and be able to learn and grow without any difficulties. So we're making it as easy as possible, less complicated at Howard University hospitals with our outpatient pediatric clinics. They don't even need an appointment. They can just come on into the pediatric clinic to get the COVID vaccine. And what we're finding is that the parent or the adult that is with them also has not had the vaccine, and we're giving that to the adult as well.
One-stop shopping.
Absolutely. We're not going to let them leave, so to speak. Certainly not going to keep them against their will, but just saying that it is that important for this thing to happen. In addition to us to having the adult clinics on Tuesdays and Thursdays, Monday through Fridays, it's the pediatric clinic every single day during the week, because we're trying to capture this population. And there is some reluctance still. They're not necessarily convinced that they're at risk, that the children are at risk. And so that education is very vital and important in helping them to see that it is necessary for their children to be healthy.
And that the access piece is really important, Dr. Medley. Can people find out about those Howard clinics by calling the hospital?
Absolutely. Yes. Calling the hospital. You don't need an appointment, although you can have one as well. You don't even have to go through the hospital registration system. You just go straight to the towers up on the third floor, goes directly to the pediatric clinic there, and you will be taken care of. The child will be taken care of.
All right.
Definitely.
All right. Good to know. Thank you, Dr. Medley.
You're welcome.
Elizabeth asks, what are some of the possible side effects of the Pfizer vaccine for children, and Pfizer is the only vaccine for children right now. And I think this is a huge question that a lot of parents have. Dr. Janine Rethy, I'm going to send that one over to you. You're with MedStar Georgetown University Hospital.
Yeah, so the side effects that we're seeing with the vaccine for the 5 to 11-year-olds are very similar to what we're seeing in the older teens, but actually a little bit milder, which is great. So in the study, the kids had side effects that many of us have experienced. So a little bit of fatigue, sometimes low-grade fever, sore arm at the site of the injection was common as well. So all in this sort of mild category, and all of them went away after a couple of days. In the younger kids, we didn't see any of those more significant adverse events at all. And so far, you know, we're several weeks into the vaccination program for the 5 to 11-year-olds across the country. And as you know, we are all required as healthcare providers to report any serious adverse events to the federal government. And to my knowledge, we haven't heard any serious adverse events to date. The others can chime in if they've heard anything that I haven't, but mostly just these sort of mild 1 to 2 day side effects. And the big take-home message, I think, for everybody to know is when you have those side effects, it actually shows that your body is creating an immune response that you want. So it's something that we should welcome in a way. It means our body is creating those antibodies and that long-term immunity that we're looking for.
And that's the side effects you're talking about, soreness, fatigue, those things are short-term.
Correct. Very
short-term. All right. Thanks, Dr. Rethy. Next question is coming to you, Dr. Maria Marquez from Mary's Center. Can you share some insight about the clinical trial conducted for this group? I think this is also something that so many parents are concerned about. It seems like the vaccines were developed much more quickly than is the normal than vaccines have in the past. This is a new thing entirely, and it makes people a little bit nervous. How do the clinical trials work?
So the clinical trial for 5 to 11-year-old vaccination process were including around 3,000 patients or participants, and of which 750 were injected with placebo, and the rest were given the vaccine. And they realized that 3 of the vaccinated children had infection and had symptoms. And 16 patients that received the placebo got the infection with the symptoms. So yeah, I mean, that started happening since the beginning of the research, that they were progressively incrementing the age ranges. And today we have 20% of the 28 million children that are due for the vaccination 5 to 11. And we haven't, as Dr. Risley mentioned, there's no major severe reaction that have been reported for this age group of children. It has been described that is just with a very short course of side effects, very mild, and very similar to, I think, any vaccine we give to children. As a pediatrician, I tell the parents, if you see a little bit of fever, that's good reaction from your body receiving the vaccine. So just be attentive, and they start receiving vaccines since the first day of life. So it's very common. And so the reactions of 5 to 11 has been very minimal compared with maybe adults experience a little more serious side effects, but it results with Tylenol. So I always tell them, if there are any complaints or any concerns, you can get Tylenol, and it shouldn't last more than 3 days. It shouldn't be high fevers or anything serious, as so far hasn't been reported. It is something that we need to keep in mind, because it really happens with any vaccines that we apply to children every day in the clinics. And it is really a vaccine that has demonstrated that is effective. They also study the minimum dose they could give to avoid serious side effects, and is also protective. So This amount is 10 micrograms and is for adults or older than 12 and older are 30 micrograms. So the 10 micrograms demonstrated to produce similar protection to the 30 in older people, and is also a lower amount and has demonstrated even during the research that it was milder side effects.
Well, I'm glad you brought that up because I wanted to ask about that next. Children age 5 to 11 are getting a smaller dose. Are they getting the same level of protection from that smaller dose?
Yes, they demonstrated that it's a very similar protection for kids 12 and older that receive 30 micrograms, and the younger ones are receiving 10, so a third of the older ranges of ages. And they proved that during the research that they do get a good amount of antibodies and protection with 10 micrograms, making sure that also they gave the lowest dose that is protective, but also produce minimal side effects. So it's actually, we started since November 3rd in the district, and it has been, I haven't seen any reactions. We're vaccinating every day, and is something that we are attentive. We're still asking to wait for 15 minutes as possible, because if there is a serious allergic reaction, it normally happens the first 15 minutes, and that's the recommendation to be happening. One thing I think is, I want to clarify, I think this vaccine has been researched for many years, and it's not really a new vaccine. It didn't start happening. It's new in the implementation because it's a very sophisticated vaccine to produce in a big scale, and it's also very expensive. So I think we needed this kind of reaction as a serious pandemic that everybody made this happen. And but this vaccine has been studied for more than 20 years in different situations until they put all the data together in March 2020 and started saying, like, this is the future. If we get the support and the need, we're all going to make this happen. So in my opinion, it's a miracle vaccine, and I think it's the future for vaccines in the world, but it's not something that was started to be studied in March 2020 or even November 2019. It has been going progressively studied and actually modified in different ways that is becoming this safe vaccine that we have today.
This is the mRNA vaccine that you're talking about, which is new technology, but it's been in development for many years.
Yes.
I appreciate that. Dr. Bogard, you mentioned that you had your own child vaccinated. Any side effects from your own child?
No, she had, I should say, a soreness in her arm on the day she got both shots. And I like to say she's very dramatic and likes to tell me how she's feeling. And even when the next day, when I was like, how's your arm feel? I think she would have milked it if it hurt at all, but she said it was fine. So, yep. And all her friends, I've been kind of surveying people on the playgrounds and in clinic, and it's all really good news. I think they picked a right dose where you can be protected with your antibody response, but at the same point, you have minimal side effects. So it's all really good news.
Anybody else with a young child who's been vaccinated and may or may not have had any side effects? Okay, I think hearing about a physician who has had their own child vaccinated, I think sends a pretty strong message to people.
I have 3 teenagers, so they got the 12.
We got the dosing. Okay.
Pretty much the first day that it was available, they were in line for their respective ages, and all did very, very well with it and protected.
Okay. No, were they as dramatic as Dr. Bogard's daughter?
Well, they got out of dishwashing duty that night for sure.
Okay, that's a good thing. Let's see. Next question. Can you speak? I guess we'll go back to you, Dr. Bogard. I'm trying to go in order here. Can you speak on the data that shows that the vaccine is safe and doesn't have an impact on the kids later on? Long-term effects.
Yeah, it's a really good question and something that comes up a lot. Mm-hmm. If you bear with me, I'm going to explain a little bit how vaccines work, because I think when you understand how they work, it kind of demystifies a lot of the scary stuff, because I think to some extent, when people come to clinic, they're almost worried this is like this medicine or this like green goo that we're putting in their body that's just going to like protect them, but have different effects on their body parts. And what I want you to know is that the vaccine is a helper for your body, so it can do what it does every day, which is it interacts with the outside world. And if something from the outside comes in, it realizes it doesn't belong to you. And an antibody will grab a hold of it and say, this is really strange. This isn't ours. This is scary. Let's set up a whole army to go look for this specific thing. And in the meantime, we're going to eat this up. So what we do, we didn't have the technology. We still don't, that when this virus came up, to really just start treating it right away, right? And to protecting ourselves from it. We had to use the barriers that we were using. So the social distancing and the masking, that was the only way to kind of prevent the virus from getting into our system. But what we did know is if we could trick our body that it's seen it before, our body would be able to protect itself even if that virus entered our body. And so with this messenger RNA technology that Dr. Marquez was talking about, it's a pretty simple vaccine. It's literally some salt water, some sugar, some fat, some potassium. It's held together by Miralax, which is polyethylene glycol. It's a constipation medicine for anyone who doesn't know. And that just helps it stick together. And that's just to help deliver this recipe called messenger RNA. That recipe will enter your cells and will be read by your own body's protein making factory to build a protein. So as the messenger RNA is read, it actually builds the spike protein that sits on the outside of every one of the coronaviruses. What's nice is that spike protein is harmless, even when it's on the virus itself. So when it sticks, it just helps the viral particle stick to your cells so that the virus can enter your cells. So what we're doing is we're having this limited number of recipes read by your system and building a limited number of proteins. The messenger RNA is eaten up as it's read. It's kind of like Inspector Gadget, like the message explodes after it's being read. And then all of a sudden these spike proteins are floating around your body and your body's like, again, this is weird. This doesn't belong to us, grabs a hold of it and builds this antibody response in case it sees it again. What's also cool about it is as that happens, it eats up the spike proteins it just created. And the reason I say all of this is because the vaccines are actually made to break down inside your body, right? That's the whole point of the vaccine. It's supposed to be recognized as foreign and broken down. And that's what happens. And the good news is that even though this technology is new, even though I would try to remind people, what did your cell phone look like 17 years ago if you didn't have a cell phone? That might even be more scary for people. But at the same point, like the technology is new, but what your body is doing is how it's protected us since human beings were created. So your body's doing the magic and doing the work. And what we do know is that with every vaccine that's ever been created, there have never been any late onset side effects past the 2-month period. So given that we know it's doing the same thing that every vaccine has done in the past, which is just priming your system to be able to fight off against something in a larger quantity or in a different shape, that we don't anticipate any long-term side effects. And hopefully that helps make you understand why it wouldn't be the case. Because remember, your body's doing the work. The vaccine is just the hint to kind of get it prepared if it sees that one thing again.
Why do you think people have been vaccinating? We've been vaccinating our children for measles, mumps, and rubella, and polio, and chickenpox, and the flu for generations. Why is this vaccine different? Why are people more reluctant to do this one? Dr. Medley, you want to take a crack at that one? That's my question. I'll get to some more.
Certainly, that's a very, very good question. I think it depends on the population that people that you're talking about or considering. I know in the Black and African American population, there is hesitancy because of a trust issue with healthcare, and reasonably so. There were instances in our history where, there were experiments done that were not quite ethical, and so that through the generations and through years has been held close to to individuals not feeling they can trust. So now they're feeling like this is a brand new vaccine, as was addressed just moments ago so eloquently. And it truly isn't, except for the fact that now it's being implemented. So it's just having that kind of understanding and building trust with the people that we serve, and being that role model, as has already been mentioned. I got my vaccine very early on. Tomorrow will be a year when all of the senior executives at Howard University Hospital got their vaccinations, and our CEO and several others were, pictures were taken so that it can get out to the community. And we're still, alive and well, and doing very well. I don't have small children anymore, but my adult children have all been vaccinated. My husband has been vaccinated, and so helping people to understand that within our own population, within our own community. I also think that hearsay and fear, regardless of our cultural background or heritage, that is pretty much within our society right now. And there are myths that are very difficult to overcome, but we should not grow weary of being steadfast in addressing these things and helping people understand that we do believe the science. And we are trusting the science. It has helped us for generations, as you just said, and it will continue to do so. We just need to overcome our fears with more education.
People are exposed to so much misinformation these days, and that's a big factor. And we are not going to solve that problem here tonight.
And I'm sorry, there's one other thing I did want to share too, where we actually had our CEO meet with the descendants of the Tuskegee experiment. And they were very eloquent in speaking directly to, yes, this happened to our great grandparents, or, and we are saying, get the COVID vaccine. That has nothing to do with what we're going through today, what we need to be doing today. They all have their vaccines, their COVID vaccines. And so they were telling everyone in the audience to please go get that vaccine too. So
I had not heard about that. Well, thank you for sharing that. I appreciate that. Here's a question that is interesting from Eden. It says, my whole family got the Moderna vaccine. So should I wait to give my child Moderna instead of the Pfizer vaccine? Dr. Rethi?
I think that the best vaccine is the vaccine that's available at the moment to help protect your child from illnesses that all of the doctors have talked about today, and also protect your family, protect your community. And as we've seen now with Omicron, protect us from having other variants coming down the pike that can prevent us from getting us all back to our normal lives. And I think particularly kids have been hit so hard without having a normal childhood. I mean, this, as we were talking earlier, this pandemic has gone on for almost 2 years now. And these are the most lovely years of children's lives that, they have been altered so drastically, and we don't even know how that will affect them long term. So for our whole community, the quicker that we can get this under control, we can get community spread down, we can decrease the chance of the variants, the better. I think families understand that. I think kids understand that too. They want to be a part of a solution for our whole community. So I think that the sooner that we, our families and our communities feel comfortable with the vaccine, they feel like they have enough information from us, they feel like they trust the providers who are giving them the vaccines, go ahead and get that vaccine for sure. I hope that this conversation has helped you feel comfortable with the Pfizer vaccine, the safety of it, the efficacy of it, and the promise for ending this pandemic.
And we should say that the Pfizer vaccine is the only one that's available now, and we don't know when the Moderna vaccine might be approved for the younger children. I think didn't they went to the FDA once for approval for the younger children, and they were told to do more clinical trials, or put together more data. I think I don't want to misspeak, but
right. I didn't think it's there on the timeline.
It's unknown.
Right, exactly. But there are similar vaccines, similar safety and efficacy profiles, certainly in the older populations. So hopefully they will get approved at some point so we can get more vaccine to more people. But for right now, we do have the Pfizer vaccine. We have a nice solid supply of it here in DC. So it is widely available. And I hope that you find a provider that you feel comfortable with and get your kids the vaccine.
All right, thank you. Let's see, Dr. Marquez, you're up next. What if my child already had COVID-19? Does that 5 to 11-year-old, does that child need a vaccine, or do they already have immunity because they had the virus already?
Oh, great, you got the question. I was actually going to comment that I had 3 teenagers, of which one in college got COVID in January 2021, and he did not have the vaccine. So he got the disease. It was mild, as he was a healthy teenager. And he got the vaccine as soon as it was approved for his age and his health conditions, as he has none. And he's a very healthy 19 years old. And the first day that they were approved, I brought the 3 of them. And it is now the data shows that that if you have the infection and you have the vaccine, you may have a very solid protection, even if you already have the infection. If you just get the infection, it's going to be really hard to know how much protection you got from the infection. How long is it going to last? Is not a permanent protection if you get antibodies after the infection. So it's actually highly recommended to get the vaccine even if you have a history of an infection prior to your vaccination. It's really proven that it really reinforces the protection and the production of antibody that Dr. Boger explained very beautifully, even with her attacking and everything. And it's really necessary that we all get the vaccine. We all also want to add that when you get the vaccine, you protect anyone who lives in your house. If you have one vaccinated person in your household, you may protect 60% of your household members. And if you have 3 to 4, you may protect your household members around 90%. So if you have children that are less than 5-year-old, they are not qualifying for vaccine to date, and you may be helping them to be protective and get less infection as well. If you are a person who has a chronic condition that may be a high risk for severe disease, you're also protecting that person, not only you, but that person and also the community, because there's a community immunity that we need to keep going towards that one, and is around 75% or above of the population. We're not there yet, but it's slowly getting there. So let's all get the vaccine and keep going.
And Dr. Marquez, that is such an important point to make. A lot of families did not gather over the holidays last year. The vaccine wasn't available and travel was risky. This year, everybody is, anxious to get together, and unvaccinated children can endanger other family members. Mm-hmm. How long you talked about your son getting the COVID virus? How long is there a period of time that you should wait after a COVID infection before you get the vaccine?
That's a good question. They say around 2 weeks after the infection, but I'm a big believer that if you find it, get it, and then yes, it's around after 2 weeks. You may be able, and sometimes even if you have a flu as well, some people recommend to wait.
And is it okay to get the flu vaccine at the same time as you get the COVID vaccine?
Yes, you can get. Yeah, you can get them together. Yeah.
One in each arm.
Yes.
All right, let's go back to the questions. What if my child is about to turn 12? Dr. Bogard, want to try that one?
Yeah, so the dosing, like we talked about, is for 12 and older, they get 30 micrograms of the messenger RNA vaccine, and the 5 to 11-year-olds get 10 micrograms. And the dosing is purely based off of age. There's nothing really special or magical that happens to your immune system on the 12th birthday. It's just how it was studied, which means it's how we are allowed to give it to you. So at 11, you'll be getting the 10 microgram dose. And then let's say even like a week later, someone turns 12, so they go back for their second vaccine, you would end up getting the higher dose as like a 30 microgram dose. So it's age related. We've gotten questions too. I'm like, what if I have a really big 11-year-old, or my kid will turn, you know, in January, they're turning 12. And like Dr. Rethy said, the best vaccine is to get it when you're ready, as soon as you're ready, because COVID is out there. We were coming off that fourth, you know, wave, and we are headed right back up while we're going in to celebrate holidays and things like that. So hospitals are filling up again. Children are getting sick. You know, holidays are going, this is going to impact our holidays, unfortunately, this year. So please get vaccinated as soon as you're ready with whatever's available.
You wouldn't wait a week or 2 weeks or 4 weeks if you're for your child to turn 12 to get that bigger dose?
No, I think it's really telling. I was like giggling, listen to this, that all of us, we all brought our families day one, right? Like we have all been waiting for this moment to keep our family safe. And so if that can give you anything, like we're all from different places. We all know the same science. We just feel really comfortable with it. So we just feel like we have this knowledge we want to share with you guys, that it really is safe. And if anything, we joke, my husband's like, can we just pretend our 4-year-old's 5? Like, he doesn't have like an ID? And I'm like, no, we can't. Like, so I'm in that category. We're still waiting in my house for the final kid. But yeah, I'm ready and waiting. As long as everything looks as good as it did for the older kids, he will be again. He'll be getting as soon as he can. So.
All right, let's get to some more questions. Will children younger than 12 receive a vaccine card? Dr. Medley?
Yes, absolutely. Everyone who gets vaccinated will receive a vaccine card. It's very important for the records, just like their regular immunization records.
Mm-hmm. Children under 12, parents ought to keep track of that card for them, though, probably.
Absolutely, yes.
I think there was a skit on Saturday Night Live this past weekend about that card and saying, yeah, just the thing that little kids never lose a 1-inch square card of paper. But I do always recommend that children and families take a picture of that card on their cell phone and keep it there just in case that happens, that they do have a record of it. Your health system will have a record of it too. And if you do lose it and need a new card, we can provide that for you too.
It's not a good size to fit in your wallet either. So the picture in your phone is the way to go.
Yes.
All right, let's see. What if my child has an underlying condition? Should I still get him or her vaccinated? Let's see, Dr. Rethy, you want to take that one?
Yes, absolutely. Actually, those are the kids that we really want to make sure that they do get their vaccine as soon as possible, because they can be at higher risk for some of those more severe diseases that Dr. Bourgault was describing. And actually, the study just came out of Scotland last week, I believe, showing that kids who have asthma, particularly asthma that's less well controlled, have a much higher rate of hospitalizations and poor outcomes from COVID. So absolutely, if your child has an underlying medical condition, the COVID vaccine is safe for them, and we recommend protecting them as soon as you can.
Are there any children in this age group who should not get the COVID vaccine?
So the main contraindication really is an allergic reaction to that preservative that Dr. Bourgault was describing, the PEG. It's very rare, but that is the question that we do ask. If they've had an allergic reaction to another vaccine, and that is something that we do want to know about, or severe allergic reactions just in general, it's a good idea probably to be around a provider who can manage that in case there is an allergic reaction to the vaccine itself. They are just exceedingly rare, and I haven't heard any in this age group.
Okay. Should my child still wear a mask after being vaccinated? Dr. Marquez?
Absolutely. We cannot lower the guard. We're not there yet. We're getting there. As we heard from Dr. Fauci and all of us here, we need to keep the guard still going on. And as Dr. Bogart mentioned, is going up again, the incidence of the infection. So we want to make sure that we work on that. So as we know, if you're vaccinated, good news, you may be able to avoid the mask if it is not a very crowded outdoor place. If you feel like you are in a very crowded outdoor place, you may feel that you need the mask, and it may be a good recommendation. If it is indoors, it still is recommended to use the mask, because we don't know who is vaccinated, who's not. They have tried to open up indoors as well, and it changes because it's still a very fluid situation in a way that, as we know, the cases are above 100,000 today, and it's something that is we don't know where we're going. But yes, I am a big believer that universal precautions cannot be eliminated at this moment until we have a good community immunity, and we are not there yet. We need to reach the 75% of the population. And that's why we want to talk to anybody as much as you can, listen to questions, and please get people who you trust to talk about the vaccine, and especially people that you know have studied science or is related to a profession that had studied science, and what kind of concerns and questions do you have. There's a lot of misinformation, as we mentioned, and they happen very fast and every second. So we want everybody to keep questioning and have conversations with people you trust.
Dr. Marquez, is there something that you would like people to know about getting access to the vaccine for children at Mary Center?
So we are vaccinating every day, walk-in basis, and appointment as well, Tuesday to Saturday. We have phone lines. We have Helio is an electronic connection that you can get through the website to get the appointments. And yes, we're vaccinating every day since the first day the DC District of Columbia opened up for vaccination and provide the vaccines to everybody. It's a very easy vaccine to get in pharmacies and any community clinic, hospitals, and is also a vaccine that you don't need to pay for. You don't need insurance. You don't need major identification paper that you may not have at the moment. So it is extremely available. We're very lucky to be here and have it at the tip of our fingers. So take advantage of that.
Yes, we are very lucky. We can all remember when in the very early days of the vaccine, going online, trying to find a place where you could get a vaccine, and look how far we've come. That's important for us to remember.
Yes.
To remember that because there are a lot of people who don't have the access that we do.
Yeah.
Let's see, Dr. Bogart, you're going to be next with this. Will children need booster shots?
It's a good question. I think we're all waiting to kind of see that answer. What we know now, as of last week, is that everyone 16 and older, it's recommended that they get a vaccine. And that's because the virus is smart and it keeps changing. And we now have this new variant, Omicron, and we're going to try to figure out how dangerous it is. And we're looking at that science now to tell people. But what we do know is that if you can be as vaccinated as possible for your age group. So for those under 16, it's getting your 2 doses, or if you're immunocompromised between the ages of 12 and 16, getting 3 doses. And then now anyone over 16 and older should get boosted 6 months after their prior dose of a messenger RNA vaccine. That gives you the best shot to not have any to lessen your risk for COVID-19 infection. So not only getting the infection, but once you get it, decreasing your risk for hospitalization and death. And the faster we all do this, like was mentioned earlier, the less likely it is that this virus can change again, causing it to be more contagious or more deadly. So we really have to stay on top of it. The way they make that decision is they look at the science and they look to see how well people are protected with the current regimen. So for kids like 5 to 11, it's a 2-shot regimen, as we know for now, but they're going to continue studying the kids, especially in the trial, for 2 years. And then they'll sample some and see if a booster is worth it, and look to see what variants are around, 6 months from now. And then we'll get the recommendation at that point. But for now, it's hard to predict.
Given what we're learning now about the booster shots for adults, though, that the booster shot can pretty dramatically ramp up your antibodies in a short time, and it seems likely that there may be a booster shot in the future for children. It's already being encouraged. What is it, 16 to 18-year-olds, right?
Mm-hmm.
So
anyone that can get it can protect them the best, which means it protects the community too, right? So the decisions are always made. The public health decisions are tough. They're based off of resource allocation and risk to the general community. And so right now the risk is very high throughout our whole country. And with that, we have enough vaccine that we can actually get everyone boosted, encourage people to do so. And so hopefully that's the case if it's needed for the younger kids, and we'll just have to wait and see.
The personal health decisions can be just as difficult. Let me read this question, Dr. Medley. This one's for you, and I think this summarizes the way many people are feeling. One of my main issues are the side effects. I'm absolutely terrified about the long-term effects. So far, my family and I are not vaccinated, and we have been perfectly fine. I'm afraid of COVID and the vaccine. I'm open-minded and I trust your expertise, but I'm afraid.
Mm-hmm. I understand that fear. It's very real. And it's important that we convey our understanding of that. I think, though, we need to also strongly present what the science tells us and admonishes us that to get the disease is, could be very, very serious or fatal. And so it's a matter of being able to decide which is the risk and which one has more benefits and which option has more risks. Because the side effects are not as serious, overall for the majority of the population. Of course, it does matter if the child or children have comorbidities or other illnesses, underlying illnesses, asthma, or diabetes, insulin-dependent diabetes, or any other condition. Yes, that's something to seriously consider. But also, if they get the disease, it compounds the disease. It makes it worse for the child and the family as well. So this mother writes, she's afraid of the disease and the side effects. So she's aware of the cause and effect on both sides. I would hope that she would be able to trust the fact that the vaccine would seriously prevent the disease in most cases and really booster the child's immunity and system, and so that the child or children would not get the disease. And that's only going to come from building trust with that family, with the healthcare provider and the parent or parents really trusting the healthcare provider through consistency in education and accessibility as well.
Seems like it's a fear of unknown long-term side effects that really worries people.
Yes. And then on the same token, though, we could take that to other levels. We can fear many other things that are unknown, but yet we may take for granted or just say, oh, well, I'm going to wear my seatbelt, it's going to protect me. But you could really worry about the unknown with that as well, And so it's just trying to decrease their heightened anxiety about things. But it's hard because there's so much going on every day. There's different things coming on television, you know, in the papers, on social media, things like that. And it's being able to really, again, trust what the scientists are saying and what your healthcare providers are saying, and how they look as your role models as well.
All right. Let's see. Have clinical trials been done on children with bleeding disorders or hemophilia? If so, do you have data specifically on children of color? Do you want to take that one, Dr. Rethi?
Yeah, the trials tried to include a diverse patient population with a variety of backgrounds and medical backgrounds as well. I cannot comment specifically about hemophilia. I don't know if any of the other providers know if a patient with that specific illness was included. But right now, you know, there's been really hundreds of millions of doses of this vaccine given around the world to individuals with a full array of illness, underlying medical conditions. And we don't have any absolute contraindications to any of them. And again, just to stress, the risk of getting severe COVID when you have an underlying chronic disease is much, much higher. Mm-hmm. So again, speak to your provider, speak to your specialist as well, to reassure you of this as well. But just to kind of piggyback on what Dr. Medley said, I think, you know, with all medical decisions that we partner with our families to make, everything small and big, we're always thinking through, we understand that every parent just loves their child so much and wants to make the right decision for their child. And that's the basis of this decision. We know that. And so what we're weighing out is the risk of doing something, in this case, the vaccine, versus the risk of not giving the vaccine. And we sort of just weigh those two things out. And, you know, in this case, the science is very, very strong that the risk of giving the vaccine is so small, particularly for this age group, but really across the board. And the risk of not getting the vaccine is high for the child, high for the community. And, you know, this issue of even long COVID, we think about long-term side effects of the vaccine, which hasn't played out at all, never in the history of vaccines has played out actually. But long COVID, some studies have shown up to half of kids, all kids, have some symptoms of COVID persisting past 4 months.
Wow.
Which is significant, right? When you're thinking of all of these ways this pandemic is affecting our children, and long COVID is a real thing. And those symptoms, you know, interfere with the ability just to be happy, healthy kids. So just to kind of think through that as you're making your decision, again, of the risk of giving the vaccine versus the risk of not giving the vaccine. Important
things to consider. Dr.
So
Marquez.
Yes, I want to add that hemophilia, if it is contraindicated for any other vaccine, it's the same contraindication, but otherwise, if you have hemophilia is well controlled, or is really mild, there shouldn't be a contraindication for vaccination of any kind. You should get the vaccine.
Okay, good to know. Dr. Marquez, then let me ask you the next question. My children were delayed more than 30 days getting their second dose. Will they have to start over again with dose 1?
No, get it as soon as you can. The recommendation is not to give it, depends on which, but for children 5 to 11, it should be after 3 weeks, after 21 days. And if you get it at 30, 45, please get it as soon as possible. And the recommendation is not to start all over. You're just gonna get it.
Okay.
As soon as you can.
This seems like a question for all of you. Where will vaccines for younger children be available in the district?
Everywhere. As I mentioned, everywhere. You get in the webpage, they even give you a phone number. They give you a place where you can get a text, and then you put your zip code so you can get the pharmacies, clinics, vaccines, hospitals. You can get the federal high quality care centers. You can get community clinics. is really everywhere, and they have it. The information is in any. The district actually has a very good page, but all of us have great information page. Children's, MedStar, Mary Center, Howard. So just visit them, and they're really near you. Maybe walking distance. So
families can go to vaccine.gov anywhere in the country to find a clinic or provider or pharmacy near them that's carrying the vaccine. I know all of our clinics as well are doing vaccines for our patients and also for the larger community. So we're out every Tuesday afternoon on a mobile medical clinic in neighborhoods throughout DC, providing vaccines to the community and to the family members of the kids who are coming on as well. So that's been a fun and successful effort in the last month or so. But each of our clinics has similar outreach programs, as hopefully many of the pediatricians of the families listening to this call are maybe providing it as well. So get in touch with your pediatrician too.
Adults can go to can get vaccines at pharmacies. Is that option available for children as well?
It is. It's available for children over the age of 3, actually. So, of course, the COVID vaccine is only allowed for those 5 and older. But for those who have younger kids on the call as well, I think about that a lot for the next rounds, because they are studying the vaccine in kids as low as 6 months of age. So just keep, if you're worried about this at home as a parent, like I am as someone who's working on administering lots of these vaccines, I just want you to know that the city, the DC Hospital Association, we're working hard to be able to step up our healthcare resources so that we can vaccinate as many 6-month to 2-year-olds as possible when they're available, because they won't have as many options through the pharmacy system. But it's perfectly safe. My daughter got it at Walgreens, so it's perfectly safe to get it somewhere. You get the same care, you get the same vaccine. So
you're at Children's Hospital and you took your daughter to Walgreens?
Yeah, we started at our hospital vaccinating the most vulnerable kids first. And so trying to get to high priority neighborhoods and then kids with medical conditions. And luckily my daughter didn't qualify. So yeah, so my husband actually went online the first day and got it for us for like a week later. So, but yeah, it's available. It's out there if we want to get you vaccinated. So.
All right. I think we're supposed to be wrapping up at 8:30. Anybody have any final thoughts that they want to share?
We just want. Yes, I was going to say the same thing. Please have the children get the vaccine. Please.
Well, I thank you all for joining us. I hope that we have helped a whole lot of people make decisions about vaccinating their children, especially as we head into the holidays and family get-togethers, and especially with the concern about this Omicron variant that appears to be very contagious. So I want to thank each of you, Dr. Claire Bogard from Children's National Hospital, Dr. India Medley from Howard University Hospital, Dr. Janine Rethy from MedStar Georgetown University Hospital, and Dr. Maria Marquez from Mary's Center. Thank you all. We all owe a great debt of gratitude to the 4 of you and all of our healthcare workers who have been looking after us and encouraging us and taking care of us through. We're getting close to 2 years of this, and it is my hope that you all have fewer and fewer young patients and COVID patients in general going forward. So thank you for making time to answer some of these questions and share your insights with us tonight.
Thanks for having us.
Yes,
thank you.
All right, thank you. I think we're done. Are we having a final word from the Hospital Association?
Thank you. Thank you again, Doreen. Thank you for our panelists. I know our community members are very thankful. Our parents are thankful, not only for your expertise, but for your understanding of their positions and your understanding and acknowledgement of their fears and what's best for their kids. So thank you so much.
Sure. All right. Well, thank you, and safe and healthy holidays to everybody.